Hello everybody and welcome to another episode of the Rugged Medicine YouTube channel. In today's video we're going to look at the SBAR or ISBAR handover, what it is, how it works, the background, the literature, and then I'm also going to give you a practical example of its application. So let's get going. So what is SBAR? Well, SBAR, as you already guessed from the title, is a handover tool to facilitate transfer or handing over responsibility of one patient to another healthcare professional, be that within a healthcare facility or from one to the other. Now, the original system didn't actually originate in healthcare, but within the US Navy. It was then adapted for use within healthcare. As already mentioned, it's used within healthcare facility quite a lot actually. It's a very common handover tool. It is not very much prevalent in the ambulance service or EMS, as the American term goes, emergency medical services. This tool has been validated, it is a proven tool, and there is some evidence that you can look at yourself, don't just take my word for it, to read up what has been validated and how. I'll provide some links in the description as well. So what are the elements of SBAR? There are 4 elements, as the 4 letters suggests. So S stands for situation. That is where you present the situation and who you are. So, hello, my name is, and I'm calling because I need help with or I need to hand over a patient or whatever the situation may be and why. The background is the details of the why. For example, why was this patient brought in? How did the patient get here? What is the current problem? And when did this all start or occur? Then about the assessment, and that isn't necessarily just handing over everything you've done, but just the key headlines. In other words, I'm concerned the patient's deteriorating, I'm concerned that there's something going on we haven't detected, or I've already treated the following things, but I need authorization, I need support, I need assistance, or simply be, I'm unsure what the problem is, but I know I need some help. And that what you need comes under recommendation, the R, which is what I would like the other party to do. Could you provide assistance? Could you prescribe something? Could you send somebody? Could you arrange for all of those things? And in the recommendation section also, you can get instructions or ideas on what you can do while you wait for the support to arrive with you. So you heard me mention ISBAR earlier, and I was talking about SBAR. Now, SBAR and ISBAR has got the same foundation, but the I was added a few years ago, or I'm not sure of the exact date, but I think it was a few years ago, and the I stands for introduction. And that is because before, with the SBAR, S is situation, which means it's possible that when you use the SBAR acronym, that you just start going, I'm calling about patient so-and-so, about this problem, I need this help. And then they don't actually know who called, who you are, why you're asking for help, and where you're situated. So the I, the introduction, was added to ensure that that is always mentioned, so that it's actually trackable and traceable, so that we actually understand what we are sending to whom, or who is asking for help and in what context. So let's look at a complete example of ISBAR. So introduction. So I've just made up a scenario. So hello, my name is Ben. I'm a healthcare assistant in Ward C. The situation you're calling about. I'm calling about our patient, Mr. Smith. I'm concerned he's deteriorating as his News 2 score has been rising steadily. Remember, News 2 is a scoring system to detect deterioration. So this would be the prime use of something like that, recognizing when there's a problem. The background. So why is Mr. Smith here? He was admitted 8 hours ago with suspected pneumonia. The assessment. I'm honestly not sure what the problem is. I think I need some help. Because remember, it depends on the level of the patient in terms of the care they require. It depends on the level of the person who's calling for help. In this case, Ben is a healthcare assistant. He's just noticed during his routine observation that it's part of his scope and part of his role and responsibilities that there's a problem. And he's got nobody to ask that's right there, which means he has to use the resources at his disposal, which means he's going to pick up the phone, the radio, whatever it may be, and then use ISBAR in order to get some support. So he doesn't know what the problem is, but he thinks he needs some help. Remember, you don't have to ask for help only if you know you need help. Sometimes you just think you need help, and that is important. So that brings us to the last component of ISBAR, which is the recommendation. In other words, could you please come towards C immediately? I'm not really giving you the choice. I'm feeling like I need help here, which means I need somebody to come, or at least give me specific instructions over the phone if they don't think that's necessary. Now, the important thing to remember under the R for recommendation is you can also there ask for anything that you should or could do while you're waiting for the help to arrive, which might be, they might tell you, oh, could you put the patient on oxygen, or could you assess the following vital signs, or could you get trolley, the crash trolley, or could you go and get or page or bleep or whichever term you're using to get the other healthcare provider or somebody else or another specialist, or could you pre-alert somebody. All of that can be part of the recommendation. So therefore, remember the order, introduce yourself, talk about the situation briefly. This is just the headlines. The background, why is the patient here? What's the problem? The assessment, well, I don't know what I need to assess. I don't know what's wrong. Something is wrong, for example. And the recommendations. What should I do? And can you please come and help me? Now, I was talking about research earlier. There is two things that you can review in order to better understand what the background to this is. And when I said validated, that it is a validated tool earlier, and validated refers to the fact that it's been tested in a study or research, in other words, to validate the tool itself. Now, this paper that you see the cover of here is a literature review from 2018 that was published in a journal called Safety and Health. And that is a literature review about SBAR, the SBAR model, and various papers. 10 or 15 papers were reviewed in this, I think, if I remember correctly, and they are highlighting what they checked for, what the benefits were, and how it was actually used and what difference it's made. What I'll also do is I'll put in a link in the description for a video that's also here on YouTube that explains ISBAR. It's an Australian video that introduces the background, why it is needed, and then it runs through the ISBAR version as well, the ISBAR acronym as well, and therefore you can hear somebody else explain it as well, not just me. And that brings us to the end of another video. Thank you very much for watching. Please like, please subscribe, and I'll see you for the next one. Bye for now.